Have you ever experienced a severe headache that just doesn't go away? Well, that's a common description of a migraine, a neurological condition that's far more than just a bad headache. Migraines are a complex beast, with symptoms that can vary from person to person. Typically, they are characterized by intense, debilitating headaches that can last for hours or even days. The pain is often on one side of the head, and it may be accompanied by a host of other symptoms. These can include sensitivity to light and sound, nausea, vomiting, and visual disturbances known as aura. Some people experience warning signs before a migraine hits, like changes in mood or appetite or fatigue. These premonitory symptoms can serve as a kind of early warning system. Migraines are a common health condition, touching millions of lives worldwide. They can be disruptive, making everyday tasks feel like monumental challenges. If you've ever experienced a migraine, you know it's not just a normal headache. So, what exactly causes these severe migraines? You may wonder. Well, our understanding of migraines has evolved significantly over the years. The medical community now believes there's no single cause, but a combination of factors that contribute to migraines. Firstly, genetics play a substantial role. If your parents or siblings have migraines, there's a good chance you might as well. Scientists have identified several genes associated with migraines, suggesting a strong hereditary link. But it's not all about genes. Our environment also plays a crucial role. Living in a high-stress environment or experiencing dramatic changes in your sleep patterns can trigger migraines. It's a reminder that our bodies crave consistency, and sudden changes can throw off our internal balance. What we consume can also factor into migraines. Certain foods and drinks have been identified as possible migraine triggers. These include aged cheeses, processed meats, and alcoholic beverages, particularly red wine. Even something as simple as skipping a meal can set off a migraine in some people. Lastly, let's not forget hormonal changes, particularly in women. Fluctuations in hormones, such as those that occur during a menstrual cycle, can trigger migraines. This is one reason why women are more likely than men to experience migraines. Now, it's important to note that triggers are not the same for everyone. What might cause a migraine in one person might not affect another person at all. This is why understanding your personal triggers is so crucial. It's about learning to listen to your body and recognize the signs. In addition to triggers, researchers believe that migraines are related to changes in the brain and its interactions with the trigeminal nerve, a major pain pathway. Imbalances in brain chemicals, including serotonin, which helps regulate pain in your nervous system, may also be involved. Understanding the triggers and causes of migraines can help you manage them better. By recognizing what might set off a migraine and taking steps to avoid those triggers, you can reduce the frequency and severity of your migraines and improve your quality of life. Living with migraines can be challenging, but it's not impossible. Picture this. You're planning a day out with your friends, or you have an important meeting at work, and then, out of nowhere, you're hit with a migraine. The throbbing pain in your head forces you to cancel your plans, retreat into a dark room, and wait for the storm to pass. This is a reality for many people living with migraines. Migraines can disrupt your life in many ways. They can cause you to miss out on work or school, making it difficult to maintain a consistent schedule or meet deadlines. They can also interfere with your social life, as you may often find yourself having to cancel plans or avoid social situations for fear of triggering a migraine. In addition to the physical pain, migraines can also take an emotional toll. The unpredictability of migraines can lead to feelings of anxiety and depression. You may find yourself constantly worrying about when the next migraine will strike, or feeling guilty for letting down your friends, family, or colleagues due to your condition. But living with migraines doesn't have to mean living in fear. Having a strong support system can make a world of difference. This could be friends or family who understand your condition and are there to help when you need it. Or it could be a professional, like a doctor or therapist, who can provide guidance and treatment options. Coping mechanisms are also critical. This could be anything from practicing relaxation techniques like deep breathing or meditation, to maintaining a regular sleep schedule, to identifying and avoiding your personal migraine triggers. Remember, you are not alone in this journey. There are countless others who are also living with migraines, and there are resources available to help you navigate this path. Living with migraines is not easy, but with the right strategies and support, it can be manageable. So how can you manage migraines effectively? Managing migraines can seem like a daunting task, but it doesn't have to be. There are numerous strategies and treatments available that can help you take control and live a more comfortable life. The key is to understand that managing migraines is a comprehensive approach that includes lifestyle modifications, medications, and alternative therapies. Lifestyle modifications play a crucial role in managing migraines. For starters, maintaining a regular sleep schedule can go a long way in preventing migraines. Lack of sleep or too much sleep can trigger migraines for some people, so it's essential to aim for a healthy balance. Similarly, regular physical activity can help reduce the frequency and severity of migraines. But remember, it's not about pushing yourself to extremes. A moderate, consistent routine is more beneficial. Eating a balanced diet is also important. Some foods and beverages are known to trigger migraines, including aged cheeses, red wine, and foods with high levels of additives. Keeping a food diary can help identify potential triggers. And don't forget hydration. Dehydration is a common trigger for migraines, so make sure you're drinking enough water throughout the day. Next, we have medications. There are two types of medications used for treating migraines: preventive and abortive. Preventive medications are taken regularly to reduce the frequency and severity of migraines. Abortive medications, on the other hand, are taken at the onset of a migraine to stop it from progressing. The choice of medication depends on various factors, including the severity and frequency of your migraines, other medical conditions, and potential side effects. It's crucial to discuss these aspects with a healthcare provider to find the most suitable treatment for you. Alternative therapies are also an option. These include things like acupuncture, biofeedback, cognitive behavioral therapy, and certain dietary supplements. While the scientific evidence supporting these therapies varies, many people find them helpful in managing their migraines. Again, it's important to discuss these options with a healthcare provider to ensure they're safe and suitable for you. The key takeaway here is that managing migraines is a highly individual process. What works for one person may not work for another. That's why it's so important to work with a healthcare provider to develop a personalized treatment plan. This plan should take into account your lifestyle, medical history, and personal preferences. It should also be flexible enough to adapt as your needs change. Remember, managing migraines is not about achieving perfection. It's about finding strategies and treatments that work for you and integrating them into your daily life. It's about understanding your triggers, knowing your options, and making informed decisions about your health. It's about being proactive and patient with yourself as you navigate this journey. Managing migraines is a journey, but with the right tools and resources, it's a journey you can embark on. Migraines can be a debilitating condition, but knowledge is power. Throughout this discussion, we've unraveled the complex world of migraines, showcasing not only what they are, but also their causes and how to manage them. Migraines are not just another headache. They are a neurological condition often characterized by severe throbbing or pulsating pain, usually on one side of the head. Accompanied by nausea, vomiting, and sensitivity to light and sound, they can significantly impact your daily life. We've delved into the medical explanation of migraines, highlighting how they are not just a result of stress or poor diet. They are a complex interplay of genetic and environmental factors, with certain triggers igniting a chain reaction in the brain that results in a migraine episode. Living with migraines can be a challenge. They can disrupt your routine, affect your work, and put a strain on your relationships. But remember, understanding your triggers and managing your lifestyle can go a long way in controlling this condition. We've also explored various strategies to manage migraines. From preventive measures like adopting a healthy lifestyle and avoiding known triggers, to therapeutic interventions like over-the-counter medications, prescription drugs, and alternative therapies. It's important to remember that what works for one person may not work for another, and it's often a process of trial and error to find the right combination of treatments that work for you. But above all, it's crucial to seek medical advice if you're suffering from migraines. A healthcare professional can provide an accurate diagnosis, guide you through the maze of treatment options, and offer support and reassurance. In conclusion, migraines are a complex condition that can significantly impact your life. But armed with the right knowledge and strategies, you can take control and manage this condition effectively. Remember, if you're suffering from migraines, you're not alone, and help is available.